about 80,000 chemicals are cataloged by the US EPA, with some estimates showing that there are over 1 million man-made chemicals in the environment. Our team at FreshAir has developed wristbands which can be used to screen against hundreds of thousands of molecules of which we may be exposed to. These devices can be worn throughout the day, helping us understand how the products we choose, our activities, and our environment contribute to our exposure profile. They can be worn as a wristband or in the form of a magnetic clip on our shoes or collar. As we perform our daily activities, small molecules and particles, often invisible to our eye, are collected in the devices. For example, the chemicals from the off-gassing of manufactured desks, inks, and paper may be detected. These molecules and particles are inhaled. For example, the chalk dust we breathe in when we're drawing on the chalkboard. After a certain period of time, which can range from a single activity to multiple days, the devices are sent back to the laboratory for testing. Using state-of-the-art technology, we are able to identify chemicals for which clients are exposed to and estimate the relative amounts of exposure to each chemical. By automating sample analysis and data processing, we are able to screen hundreds of thousands of molecules across hundreds of clients in a single week. Our current funding mainly comes from government partnership and academic grants, linking environmental exposures to questions of health and disease. For individual clients, the main deliverable will be a report showing what types of chemicals and the potential risks of these chemicals the client is exposed to. This information will be reviewed by experts at FreshAir to help clients understand possible health implications and design further follow-up studies to determine sources of exposures and possible ways to reduce these exposures. For clients who do not have the means to pay for individual tests, government grants will continue to be obtained for public health interventions in at-risk populations. We have already deployed these devices across the world, finding chemicals of universal concern, as well as chemicals specific to certain geographical locations and individuals. Our devices are the first relatively low-cost and high-throughput means to link our environment to our health at the individual level. Diseases ranging from cancer to neurological disorders are often not caused by genetic factors, but rather environmental exposures. As Linda Birbaum, the former director of National Institute for Environmental Health, states, "We cannot change our genes, but we can change our environment."